From the pre-recorded presentation is joining us Dr. Ricardo Ghelman from Brazil, pediatric oncologist and a leading voice in bridging conventional medicine with TCIM, advancing integrative health across the Americas. After this pre-recorded presentation, we will have the chance to ask Dr. Ghelman some questions because he is also connected online. So, Professor Ghelman, can you hear us now? No, it's pre-recorded. So let's go. Let's start. Sorry. Let's start.
Good afternoon. I would like to thank a lot Dr. Pfeiffer to invite me to join from Brazil. I'm Professor Ricardo Ghelman, chair of the Brazilian Academic Consortium. I'm the founder of that consortium that connects researchers around the country. I'm a pediatrician, pediatric oncologist, family doctor, and with my background in anthroposophic doctor. And currently, I'm the professor of the Department of Medicine and Primary Health Care in the Federal University of São Paulo. And my training in the research was the field of neuroscience, in the field of anthroposophic medicine, and also I'm president of the Department of Integrative Pediatrics in São Paulo Society of Pediatrics. In the last 6 years, I became advisor of WHO in that field of TCIM, Traditional Complementary Integrative Medicine. It's a big pleasure to share our experience in that very important congress, our brother congress in Prague, because in some days we have our congress in Brazil. Then, in the spirit of cooperation, I show that picture that show a big group that are met since 2 years ago at WHO to establish the Global Center of Traditional Medicine. And I'm in the middle of that picture because this is the space that we need to go between. We are in the moment to unify our efforts. Starting with the concept of integrative pediatrics that was developed from the American Academy of Pediatrics. What's the difference with the integrative medicine in general? It's because we're talking about the infant, child, and adolescent, including the elements of lifestyle, including the family health. Then that's very important to embrace in the triad the infant, family, and the health professionals in all that process. And certainly it's evident informed and use our approach therapies that it's necessary. The new concept of integrative pediatric comes in 2019 when we developed as international symposium inviting the leadership from 10 countries. And then we include beyond the former concept also the different medical systems that need to be respected in the combination of the conventional practice, not only the body, mind, and the natural products, but think about the different medical systems. In this article from Eric Barnes from Netherlands, he shows the 6 main medical systems or whole medical systems, 3 in the East and 3 in the West, that follow the big agenda of inclusion from Chinese, Ayurvedic, Unani medicine, also to homeopathy, naturopathy, and anthroposophic medicine. And the mainstream is the 7th one, the allopathic conventional medicine, but we need to embrace all that fields. But don't forget that beyond the East and West, we have the indigenous knowledge, indigenous science, indigenous medicine as a tradition that usually are not visible, but this is from Amazonia area in my country. Since 2006, in the last 19 years, was established a national policy including 29 modalities of integrative approach, and you can see didactically can be divided in whole medical systems, natural products, and non-pharmacological therapies that are spread basically in primary health care. In 83% of the cities, 9% it's basically primary care, and also in hospitals, but this is not so strong model. Then, since that São Paulo agreement that was established the new concept of integrative pediatrics, we included all that countries that you can see here: Argentina, Brazil, Canada, Chile, Colombia, Germany, Israel, Netherlands, Switzerland, and USA adopted that declaration. And what proposed that declaration? To care about the healthy development of the child. Then we'll talk more about the developed perspective, but this is very important to cover the whole spectrum of the whole life, since the prevention and until the end of life. But this phase of the life, it's very important. This study, for instance, from the North Carolina University shows that only 4 hours per week, if the children stay in the nature, can avoid or reduce the Ritalin from attention disorder, that it's very simple, but spending time in the nature can contribute to the whole healthy development. Also, in that document, we talk about good pediatric practice, include the preservation of the natural environment as health. This is so important in the big concept of planetary health for children. And then healthy lifestyle includes a perspective that usually it's not so developed nowadays, like the wording of woods derived from trees, looking to real tri-dimensional world outside the window, under sun, wind, rain, smells, sounds, taste, colors. This is the new way to think, to come back to the normal perspective, because nowadays what the current situation is they develop under treat, because there is a disconnection with the nature. The world of plastic derived from petroleum, the body is paralyzed, time organized in minutes, space confined in rectangles. That's the poor situation of the childhood nowadays. That study compared the two lifestyle in the nature and the disconnect with nature in urban lifestyle, showing the impact of that in the allergy. That includes 15,000 children from 5 countries in Europe, showing that just to live in the nature environment, natural environment, reduce 70% of the incidence of allergy. Then come that big concept about the body as a nature, as a body planet, and the concept of holobionts, and think about the whole genomic of the microbiota together with us. It's a whole hologenomic. To the landscape of this developing, it's very important to think about, from one side, about the happiness, the mental and spiritual health of the family, the sense of coherence, and for other side, we have more the environment, the nutrition, sleep, movement, well-being, vitality, the body health. Then between both levels, you can the whole develop as a constitutional development under the strong influence from the environment or from the family. In that multidimensional perspective and holistic landscape, you can think about this comes from the vision from anthroposophic medicine, the 4 levels of 4 dimensions: the existential, the emotional, the vitality, and physical structure dimension. You can divide all different modalities of care in these 4 levels. It's just an overview from the concept of the multidimension. And when we look the effect of meditation or yoga, you can see that the effect impact since the emotional level, the spiritual level, but also reduce inflammatory cytokines and reduce and increase the CD4 as increase in immunity, but also increase the telomerase activity, showing effect on the longevity. Then seems all the approach that we can use go beyond one specific effect, but in complexity of multi-dimensional of human being. These studies showing that Qigong from Chinese and acupuncture have effect on the autism, but also meditation reduce anxiety and attention disorder. And for that perspective, what means childhood and children? From the phylogenetic perspective, you can see that the brain develops since in the archicortex from the dinosaurs, from the saurians, reptiles, and birds that have that inner part of the brain, that it's a kind of point of iceberg, because the biggest area it's in the gut area. This means the first brain that are related directly with the survival instinct activity. The second brain, the limbic, are related with the mammals, the paleocortex, that are direct related also with the feeling and emotional intelligence. And the third, that it's more modern, from the primates and hominids, the neocortex, create the cognitive intelligence. Then the 3 intelligence, the sensory-motor, the emotional, and cognitive are related with this. But what's so important to mention about that in the childhood? Because when we develop that 3 intelligence, basically in the first, second, and third childhood. I'm naming third childhood instead of adolescence, but the first childhood until 6, 7 years old, the second childhood until the puberty, 12, and the third childhood until 21. And all that 3 intelligence and the 3 brains are related also with the basis of the body that come from 3 layers, embryonic layers, the endoderm, mesoderm, and ectoderm. We extrapolate the relation with the 3 embryonic layers with the development of the society and the culture. You can see the interest from humanities, health science, and exact science related directly with the exact science more with ectoderm and the brain-oriented person, health science to more heart-oriented person that like to care, to have affection, and the humanities with the gut, with interested to do, like social science, sport, law, literature. Since the beginning, after the birth, we developed neurologically in the first year from the movement of the fish, then the frogs in 3 months that keep the neck, and from the neck tonus we develop from the cranial development, we pass to the mammals, to the primates, and we achieve in 1 year. One year, the Homo erectus standing upright. This is just the first year. All that development depend of the stimulus from outside that consider one epigenetic effect, because nobody do that process without contact with adults, with people that are developing. It's not natural, but it come from one impulse inner, but depend of the epigenetic effect. Children that was not contact with adults because was, for instance, lost in the forest, have contact only with animals, couldn't be upright, never. And until 2 years old, we have that explosion of synaptogenesis, increase the number of connections with the brain. Until 2 years, that means the period named the gold period of 1,000 first 1,100 days of the life. During that process, after the Homo erectus condition, we developed the liberation of the hands and then the Homo sapiens. All the three evolutionary brains, then you develop these three big areas of will, feeling, and thinking. And you can see nowadays the concept of the gut brain axis are related together totally with that concept of 1, 2, and 3 brains. I'll go a little bit more quick, looking to the first childhood, the process of myelinization. It's very important until 6 years old. And if you look the whole picture until 21 years old, you can see the brain of reptiles, the mammals, and the primates related with the development of the head, trunks, and limbs from craniocaudal process, developed the 3 main intelligence. Looking at that exam of brain magnetic diffusion, you can see the connection with each area of the brain until 28 years old. Then until 28 years old, we are underdeveloped, even the bones. We developed the clavicular and scapular until 28 years old of ossification. If you look during the development, also the immune system, you can see the profile of Th1, more inflammatory with fever, until 7 years. After 14, adolescents start more Th2 in direction of the chronic inflammatory disorders, more cold, and you have a good balance between 7 to 14, Th1 and Th2 in balance. The main development in the childhood, the first childhood, it's the gut, then the heart, the emotional, and go to the brain. It became more brain as adults. Crossing that third childhood, that's the last childhood, our self, our spiritual side developed, and it's very challenging because we need to deliver or release our relation with our parents a little bit to become independent. In that process, it's very useful to understand the effect of psychoactive substance, because the effects are related to become more adults, like stimulant, or become more child in the present, and the description to become in the eternal adolescents. Then we'll talk about stimulant as cocaine, depressant alcohol, and the disruptant like hallucinogens drugs. Just to share a little bit about our experience in Brazil, broadening the horizon of childhood health in the practice, we had that experience that I am honored to be the pioneer in the country. Since 2015, we established a cooperation with Charité University in Berlin to promote the integrative unit of pediatrics that represent one experience. All that field of integrative pediatrics is more developed in Europe, East Asia, and North America, but in Latin America, only we start in 2015, but it's growing. This is our hospital where we started to apply that concept. It's a public hospital, one of the biggest in the country, and specific in the area of integrative oncology, that you choose the strongest suffering of the children to develop that program. That is the area of the pediatric oncology. It's 6 floors, and it's very high level hospital concerning the effectiveness of chemotherapy, 85% of successful in leukemia, and it's completely free. It's a public hospital. And then through the partnership with our University of São Paulo and Charité, we started with a program of training the nurses in anthroposophic external therapies, bringing to the children in the suffering with, in that case of pneumonia, but also we spread through the classes the cultural presentation of integrative pediatrics, and then we start to apply the concept of body, mind, and spirit in the hospital. The body, we apply the therapeutic touch and the external therapies. The mental health, you apply music therapy and nature appreciation therapy. And to spiritual level, mindfulness and biographic counseling. In the fields of award, bone marrow transplantation, in the hospital where we have the biggest amount of suffering, as I mentioned. Then there's some images of assisted animal therapy also to the mental health, music, reduce pain, anxiety, nature appreciation therapy in all the experience to promote more gentle connection with the nature. To the older children, adolescents with leukemia, mindfulness was applied, and then we published together with the German group the results beyond the standard of care. It was a very interesting experience, a qualitative study. Then to conclude and to respect the time of the conference, I'd like to invite you, at least online, but if you would like to come in person, Professor Pfeiffer, I welcome very much if you could really come to the Third World Congress of Traditional Complementary Integrative Medicine in partnership with ISCMA and ZIM, but also with WHO and Ministry of Health in Brazil. It will be the first time in Latin America, in Brazil, and on behalf of the 6 presidents, I invite you and you are welcome to connect with us in 2 weeks. Thank you very much, and I hope to see you.
Professor Ghelman, can you hear us now, please? Are you connected?
Yes, I can hear you perfectly.
That's perfect. I hope you heard that applause.
Thank you.
A little bit. Okay, so we have some time, and I would like to ask you, we just heard and seen your presentation. Tell me, would you like to add something to it, to your presentation?
I would like just to say, in the spirit of cooperation, that I understand that the main spirit of the Prague Congress, that we will start soon to establish the international network of integrative pediatrics. I think that field, it's one of the biggest fields in integrative medicine, following the Society of Integrative Oncology, that I'm part of this society. But if any colleague think about children and adolescents in the audience, we will be glad to connect. But not only physicians, but all the health professionals that care about that period of life. It's more an invitation to connect.
Okay. Thank you very much, Professor. Mr. Tomáš Pfeiffer is here and would like to tell some nice words to you as well.
Dear Ricardo, my regards from Prague. Let me express them, and let me also express my delight at the invitation to come to Rio de Janeiro.
Many greetings from us from Prague. I would like to show my pleasure that I got the invitation, and I take the invitation with pleasure.
Těším se tedy na setkání v Riu
I'm looking forward to the Congress which you are planning in Rio, which I believe will shift the public awareness of the fields of integrative medicine and also others.
Our meeting in Rio, which shifts our meaning to the TCIM.
Yes. Ještě jednou z celého srdce děkuji.
So once again, let me express my gratitude and give my regards to the distant Rio.
From here to Rio.
Thank you.
Thank you very much.
Thank you very much.
Can I respond to Dr. Pfeiffer? Can I say something?
Of course, you are still online.
Okay. Then I'd like to thank a lot the partnership with Dr. Pfeiffer representing the how that group in Europe. I believe that is the moment that we need to embrace our regions worldwide. In Brazil, you establish a big network, and we hope to be together in person next year. And also, I became part of the more connected with the TCIM, European Society of Integrative Medicine, and I believe that we can think about true cooperation in practical projects, including all the regions, Africa, Latin America, Asia. I think this is the moment to recognize, and also I'd like to mention that in Rio, you'll be pre-launched the Global Library of Traditional Medicine from WHO that already have 1.7 million of publication in integrative medicine, and officially will be launched in the second Global Summit in India. But I think this could be a very good space for us to connect and promote our field based on evidence, because this is a very important aspect. And I'd like to thank a lot, and I hope I was not with you because I'm preparing my conference, but my heart is with you and my spirit. Thank you very much.
Thank you also, Professor. And maybe now we have a chance to ask some questions from the audience, if there are any. Okay. It's not the case, so Professor Ghelman, we do thank you for your joining us online and for answering and for your presentation. Thank you very much again.